So for the past almost 30 years, we ran a rehabilitation center for cardiopulmonary disease, where our average patient was 70s, 80s, 90s, sometimes over 100, with heart disease, lung disease, sometimes heart and lung disease, and complex or multiple medical conditions. We closed our center on March 10th, 2020, because we saw what was going on with COVID, and our patients were the oldest and sickest patients in New York City, and we just couldn't, with a clear conscience, ask people to risk their lives. We didn't know it was going to be permanent. We essentially started almost immediately seeing our patients by telehealth, and I started a daily update really geared at prevention of coronavirus for at-risk populations.
You know, there's rarely a day that goes by that I don't find out that somebody I know is either very sick or has died. It's a real thing, okay?
More and more we got involved with COVID long haulers, and I started seeing people online through teleconsults. And as opposed to anything we've ever done before in the prior 28 years, COVID was something brand new. Once we had seen about 120 patients or so, we really started to feel that we needed to get into a lab, that we needed to get our hands on people, that we needed to do our own monitoring and our own testing. And that's when we were approached by Greg Hulstrong, one of the owners of H&D Physical Therapy. Greg was being asked by some of the post-COVID rehab centers or post-COVID centers, care centers, to take their post-COVID patients, except that they are primarily a musculoskeletal and orthopedic physical therapy practice. So we talked about the idea of collaborating, and through those discussions, we opened the Pulmonary Wellness Foundation's post-COVID rehab and recovery clinic at H&D Physical Therapy. Here, we've been able to see patients in person. We've been able to do testing with patients. Everything that we do here is done under fully monitored conditions. So as people are exercising, we have them hooked up to an EKG. We're able to monitor their heart rate and rhythm. We're able to monitor their blood pressure every 5 minutes, checking their oxygen saturation. And we have the ability to give people oxygen, which has a very soothing effect on the nervous system and on the cardiovascular system and on the respiratory system if necessary.
Nice easy breaths, in through your nose, out gently through your mouth. What's your stat?
100 over 60.
So, very often people will look at COVID and they'll say, oh, who's at risk? It's going to be the older patient. It's going to be the at-risk patient, the patient with pre-existing medical conditions. But Gabby's 20 years old. She was a picture of health before contracting COVID.
With most of the long haulers, they're people who are used to being super active, super fit, and have no experience. This is like a totally foreign experience for them. So that makes it, I think, that much more daunting.
Feeling better? How you feeling, Gabby? Let's put this on your thing. Good job.
COVID has changed my life drastically. I am a fairly active woman. I walk everywhere, I dance, I act, I speak to many, many people on a daily basis. COVID has taken that away from me.
Jody was the picture of health. Jody was doing Pilates on a regular basis. She was physically fit. She was active. She was a healthy eater. She got COVID.
And I think that's what's so much about COVID is the body just goes into fight, flight, and doesn't know how to come back down. I've been doing this for 6.5 months now, trying to get my body out of fight or flight and back to we're safe, we can regulate, everything's okay.
Now it's nearly 7 months later and she's still having respiratory symptoms. She's still having cardiovascular symptoms. She's still having autonomic dysfunction, and her life changed.
I remember my mom said, well, they say it'll be done in 2 weeks. So I was like, great, 2 weeks. And she says, well, now I'm hearing 30 days. I was like, great, 30 days. After 60 days, we were like, when is this ever gonna end? And now I'm at 6.5 months. It's been the hardest thing I've ever gone through in my entire life. Bar none. Nothing has been harder than living with and recovering from COVID. Nothing.
Okay, ready?
Yep.
Nice and easy. Come on up.
It is very hard to recover 6 months after I am still struggling every single day with any sort of activity, even speaking, is something that is very difficult for me still.
Don't be a hero. If at any time during the test you feel tired, dizzy, short of breath, chest pain, pressure, anything unusual, you let us know right away. Very excited. Scale of 1 to 10?
A 1.
In both of these cases, we're seeing people who started out with a serious condition or multiple conditions that over time we've seen them gradually improve. And we've seen people who, once they kind of hit that critical mass of improvement, then things really start to pick up in momentum.
Breathlessness. How breathless do you feel, or did you feel when I had you up there? Somewhat strong?
Yeah.
Okay, that's perfect.
This past week in between, I have only used my inhaler, I think, twice, which is a big improvement from before. Something has shifted. Like, this past week was probably the best week I've had.
So we found your blood pressure doppelganger.
It leaves me feeling very hopeful. You know, and the more time that goes on, the more confident I am that people are going to recover from this condition. It's not going to be as fast as they want in most cases. It may be a signal for us. It may be a lesson for us that you can't have every single thing that you want exactly when you want it.
So I just want to open your eyes and just plant a tiny seed, not a negative seed. But as you come down, you may feel symptomatic. So I'm going to bring you down super slowly, okay? But we're going to go up one more time. You're doing great. This is super exciting.
We're not in charge here. COVID's in charge. We're on COVID's timeline, but if we can learn something from it, if we can learn patience, if we can learn to be careful and to be kind to ourselves, if we can learn some humility with respect to the way that we interact with the world at large and with other people in our lives, then, you know, maybe it's not all bad. And maybe there's a way that we can come out on the other side of this that will actually make us better as individuals and also as a human race.
I hope there's a way that we all can work together and protect each other.
It's still there, and we're still recovering. Not many people were as lucky as I am to have actually survived COVID. So, yes, please take COVID seriously. Wear a mask and stay safe.